Hi, this is Inga Hansen, the editor of Metaesthetics magazine, and we're going to go ahead and get started with the webinar. If you have any questions during the presentation, you can type them into the box on the right-hand side of the screen, and we will answer them at the end of the presentation. Today we'll be discussing new laser technologies and protocols for acne treatment and how they can benefit your practice and patients. Our presenter is Kseniya Kobets, a board-certified dermatologist and practice at Skin Laser and Surgery Specialists of New York and New Jersey. Welcome, Dr. Kobets.
Thanks, guys. Thanks for having me. I'm very excited about this webinar because I love this is one of my favorite lasers. I use it every day, almost every day in my practice, and so I'm happy to share my knowledge about how it can actually help your practice grow and help your patients. So as you guys already may know, that acne is the most common dermatological disease state out there. You know, in the US, we have 50 million people affected with this problem. You know, when I was actually finishing my training as a resident, I thought I was going to be managing a lot of complex, medical dermatology. And I feel like that a lot of times I see a lot more complicated acne, and I feel like that's been kind of a very tough problem to treat in my clinic. And we'll talk about some of the points we can use to kind of use these laser technologies to improve your practice with patients. Acne affects more than 85% of young adults aged 12 to 25. It affects about 37% of adult women aged 25 to 50, and affects 25% of adult men aged 25 to 50. You know that it is actually has a lot of negative effects. It can cause anxiety, depression, social withdrawal, and obviously the scarring is both emotional and physical. And the persistent hyperpigmentation can really bring a person down. I just recently saw a patient in clinic who was taking doxycycline for 8 years, and I said, let's just kind of wean you off of it. And he was taking it for just mild acne, and he said, no, he said, I tried to come off of it. It gave me a lot of anxiety. So I think there's a lot of psychological components there to treating your acne patients. So obviously we don't want our patients to be on chronic antibiotics, and we'll see how we can try to work together with lasers and medical treatments to try to improve our patient results. So acne therapy in dermatology office, there's a lot of issues both for the patients and for the physician, and I'm sure you guys as providers are familiar with this. There's a rising social pressure to get acne cleared fast. People have proms, they have business meetings, they have weddings coming up, they just have a date they're going on, and just in general, they don't want to show up to work and having to use a lot of makeup to cover their acne. They do fear drugs, that they don't want to have systemic side effects, and there are still a lot of side effects with both topical and systemic treatments like antibiotics, Accutane, and even androgenetic, spironolactone. There is a slow clearance rates with medications. Just using medical things like topical treatments and antibiotics don't always deliver as fast as you want, and over 3 months sometimes you're just waiting for patients to clear and they become unhappy. There's erratic patient compliance with medications. You all know, patient walks out the door, you don't know what they're doing. Are they picking up their medications? Are they using them appropriately? And also a lot of times, like you see, you have the conversation with your patients, they don't want to pay, even like copay sometimes. And a lot of my patients, when they come into practice, when they don't have insurance, they actually are okay with paying self-pay for office visit. And I think that opens a door for a lot of self-pay opportunities and cash paying opportunities to help your patients in the office. As we know, especially if you're just in general dermatology, your per patient treatment revenue could be declining because, pressures from insurance companies to, fill out your notes a certain way. There's a lot of, fatigue, provider fatigue there, and trying to provide for patients. High practice administration costs and hassles. With Accutane, it's really annoying. Sometimes, from this patient standpoint, they don't register the iPledge. Antibiotic administration could be complicated, the paperwork and the coding, the billing. So you want to look for solutions to try to, at least help your acne treatment practice can be eased a little bit. And you want to also be kind of standing out to your patients. Patients are on social media all the time. They're looking online, so what's available, and you want to be kind of there up at the top notch, devices out there that AEROLASE actually advertises heavily on the social media, so you will be kind of well known. If your patients look up AEROLASE and you have it in your office, you're sort of, you know, kind of become part of that, part of the group that actually is up there to treat your acne appropriately. And patients are shop around, you know, they will look around, and if you can provide them with the tools that go beyond the medical treatment, that's very important. And a lot of times when we provide topical treatments and brand names, not brand names, drug companies take all the, you know, the profit. And so you kind of want to see if you can kind of cut into that if it benefits the patient at the same time in your practice. So the conventional approach to acne therapy is problematic, as we kind of, you know, mentioned here. So first of all, you have to make the diagnosis. So that's not always easy either, because could it be hormonal? Could it be something they're eating? Could it be something they're applying to their skin? So that's the first step. And then you have to prescribe. You have to decide what medications I'm going to give this patient. And every day there's a growing number of new topicals, new antibiotics, new treatments, and it becomes harder and harder for providers to figure out what the right cocktail is for the patient. And then you have to wait and see. Patient, you know, comes back, you try to have them back every month or so for compliance, but they may not come back, or they may not like the treatments, may not like the side effects, and then they may not like how long it's taking for the treatment to work. So kind of along the same lines with the conventional model, you've got the mild, moderate, and severe acne sort of protocols. Of course, you start with the topical retinoids, which have their own dryness and irritation associated with it, but it is one of my favorite things to use in acne patients, especially to try to build collagen and try to prevent acne scarring and kind of heal the inflammation and the comedonal aspect of acne. You can add on benzoyl peroxide, antibiotic treatments as the acne gets worse, and you can add on things like anti-androgenetic treatments like spironolactone or aldactone to block the hormonal aspect in female patients. And of course, as the nodular and nodular cystic acne presents, you can consider acid tretinoin or Accutane for the more problematic and resistant patients. But again, the side effect profile of many of these and the hand holding can kind of tie you up in your practice, and you have a lot of things to do in your practice. So another point here is that controlling patient outcome is hard and it's difficult because when a prescription is written, you don't know what happens to it afterwards. You have no control, right? So for every 100 prescriptions written, about 50 to 70 are actually filled at the pharmacy. So that's like cuts it down to half to 70%. And then about 48 to 66 are picked up from the pharmacy. 25 to 30% actually taken properly, and about 15 to 20 I actually refilled. So this requires patient phone callbacks, and then you kind of hand holding your patient through this process, because you are obviously, we're all invested in the patient getting better. And with the conventional model, you can actually see the prescription prices and costs are going up over time because of the way the newer stuff is coming out. There's newer brand names out there, and they actually do work. Some of them work better, but the treatment costs for patient for medical treatments still go up. So how do we basically try to transition this traditional model to kind of a more practical approach, something that we can kind of make it work for us? The traditional model actually also for skin of color patients, there's a lot of nuances there. So there's things you have to consider, and we'll talk about how AEROLASE NEO Elite actually addresses some of these issues because it's safe for skin of color patients, which are not always addressed in the medical treatment of acne. You want to aggressively control inflammation, because any inflammation, any red has the potential to turn into brown, especially in skin of color patients. So you do want to decrease that chance of PIH. Equally or more concerning are the dark spots in skin of color patients. They're more concerned about them, obviously, because they're more predisposed to it. There's some patient education about hair and skin products that are more oily, are more comedogenic, that can spread to the face and the forehead. That's something that the AEROLASE can address as well. And the lightening creams, that some of them could be steroid containing, can cause more acne. So we have to sort of consider maybe reducing that and using something else to try to control the PIH. And then again, topical regimens, almost all of them can induce inflammation, so we have to figure out a way, and AEROLASE can help with the inflammatory process. So we need a more effective, more predictable, more cost-effective, and cost-efficient approach to addressing acne for a modern patient, young to old, maybe along with their medical treatments as well. So moving from this model where you have the diagnosis, you prescribe, and then you wait and see, you have this great tool that is available to you now. And there are lasers out there and devices out there that can be used during active acne, but this is one of the few that I use, and it's not invasive, and it's actually one of my tools that we'll talk about how I use it, that I really feel like has contributed to my practice in treating both mild and severe acne patients. So basically, how has the Neo Elite, the AEROLASE Neopod, that was the prior name that was used, that has revolutionized acne therapy in dermatologist offices. So this technology is pretty unique. The Neo Elite Clear Acne Therapy uses a 1064 Nd:YAG 650 microsecond technology. So it's a shorter pulsed with a laser. It safely penetrates deep to target epidermal and dermal structures. As you could see in this diagram, it can affect the epidermis here for inflammation, P. acnes as it heats up. Bacteria, tone, and texture can be affected right here, whereas in the dermis, it goes deeper. It affects this excess sebum in the oil gland production here, the inflammation where the vessels are working right here, collagen stimulating works at this level. So it enters the skin so rapidly, we'll talk a little bit about that more, that it avoids pain. And so it's so high powered, it's also more effective. So there's less heat dissipated, resulting in less pain and more effective targeting of tissue. As you can see in these diagrams, so the chromophore is important. The 1064 wavelength is a vascular laser, but it also has some effect in hemoglobin, water. So as you can see, number one here, as it affects the hemoglobin, it coagulates the capillaries, feeding the sebaceous gland to reduce the sebum output. That's pretty cool. So it actually targets that from the standpoint of the oiliness of the skin. Then it goes on to, as it coagulates the capillaries, it in the dermis, it reduces the inflammation. So right, you have less vessels to bring in that inflammatory component to acne, whether it's infectious or just inflammation, and it really calms that down. The chromophore of water, when it targets the bulk tissue to superheat and destroy the P. acnes bacteria, it does it in a very specific way because of the short pulse duration. So it's able to do it very quickly and efficiently. And then, moreover, as you're treating the acne and they have the acne scarring, it does stimulate collagen in papillary dermis to reduce acne scarring. Not only does it reduce acne scarring, I think as it calms the inflammation down, I think it actually prevents some of the scarring, the impending scarring that can happen from acne, because we all know that delayed wound healing and inflammation promotes more aberrant collagen formation and potential scarring. So this is where AEROLASE is both. AEROLASE Neo Elite is more preventative as well as treatment based laser technology. So there are several articles out there in science-based evidence for this technology that has been proven to be used in acne as well as rejuvenation as well. So it's very cool that our office at Dr. David Goldberg's practice where I work, that we did this randomized double-blind controlled study to determine the efficacy and actually tolerance of this 650 microsecond YAG laser technology. At that point, it was called the AEROLASE Lipod Neo. Now it's the AEROLASE Neo Elite, and this was used therapy for the treatment of moderate to severe acne vulgaris. So acne is obviously one of the most common conditions, as we talked about. Is multifactorial. So you have to sort of address several things that we kind of already touched upon. It can cause acne, right? You've got the epidermal hyperproliferation. and excess sebum production, so it results in blockage of the pilosebaceous units. And then you have increased proliferation of some skin flora bacteria of the P. acnes and other ones that result in subsequent inflammation. So we want to kind of target those things, and the AEROLASE NEO Elite does. Moderate acne is usually treated with topical cleansers, retinoids, antibiotics. When it's more moderate to severe, we move on to systemic antibiotics or retinoids. And as we mentioned, and as you guys know, Retin-A, Tazorac can be irritating, cause people to stop their treatments unsatisfactory because they want that initial, like, within a couple of days they want to see improvement. But I tell my patients it's a marathon, not a sprint, but they still obviously want the results faster. And then you have exacerbations and remissions. Obviously through the hormonal adolescent period, it comes and goes, and they eat lots of sugar and dairy, and so that can contribute as well. And into adulthood, people come in saying, oh, why do I have acne now? I'm like 40 or 50, and what's happening? So the AEROLASE definitely can impact all those age groups. And then confusion about treatments. Patients come into the office, they look like they're understanding everything, they walk out, they forget everything. Even if you give them a handout, they call back, that's your staff that's being used up, your time being used up. So compliance can complicate definitely the treatment. So if you could do something in the office that can increase your treatment efficacy, that's in your control, that's great. So antibiotic resistance is huge. I think it continues to be a major concern because we just, sometimes the patient's so desperate, you don't want to give them antibiotic for that long, but you know that it works. So there are concerns there. And so then we, have been, as providers in the laser technology world, have been looking for physical methods to treat acne and acne scarring as an adjunctive treatment. So that included chemical peels and non-ablative radiofrequency, and I think AEROLASE NEO Elite actually fits perfectly here. So most recent studies have reported that laser ablations for acne have been helpful because they've been limited to the capacity of deep penetration into the dermal layers. You want a laser that penetrates deep but has minimal associated adverse effects. And they have been shown that laser therapies are successful in diminishing acne lesions. They halt the overactive sebaceous gland activity, also alleviate the effects of inflammation. And also, interestingly, if you activate the porphyrins that are naturally produced by P. acnes within the oil glands within the acne lesions, you can actually result in destruction of these cell membranes of these bacteria, and you can decrease your acne that way as well. So in this study, which had great results, this double-blind parallel group study aimed to evaluate the efficacy and tolerance of the 650 microsecond or the 0.65 millisecond 1064 nanometer laser in the treatment of moderate to severe acne, was done in patients that were 12 to 40 years of age. It was a double-blinded, randomized 3-center study, 60 patients, 12 to 40, that had moderate to severe. So they didn't just pick like mild acne, they actually picked moderate to severe acne. And part of the group actually had an active treatment cohort, and then the other one had a control, just sham group. The active treatment group of 30 subjects were treated with 4 sessions of the AEROLASE 650 microsecond YAG laser throughout the study, and the control group of the 30 subjects was giving a sham treatment. The visit took place throughout a 12-week period. Their photographs were taken, and then the self evaluations were completed as well. And then the porphyrin counts were taken using the Visia skin analysis to quantify the bacteria present in the pores. Sebum was measured by the sebometer, assessed both by the investigator and the subject. And then safety adverse events were also accounted for and performed at every visit. So the investigator's global assessment scale was for the moderate to severe type of acne, where there's many comedones, small to medium-sized papules, no nodules or cysts, or the severe kind where you have nodules or cysts that are present, and then they're widespread and numerous comedones. You guys have seen this diagram before where all the different wavelengths, how deep they penetrate. The Nd:YAG has the advantage of being able to penetrate deep. So it has that advantage to affect the epidermis plus the dermis and those structures we earlier talked about. So that's a very nice modality to use. The other thing that's very cool about it, like I mentioned, is that it's both painless for the most part, and we'll talk about when it could be a little bit of discomfort when it hits a hair or something. And it's also very effective because of the short pulse duration. So you can see here, the longer pulse duration, that they go a little bit longer, the treatment discomfort goes up. Whereas the AEROLASE NEO Elite here is discomfort is less. And also here, whenever there's a short pulse duration that is lower than the thermal relaxation time that's safe for the tissue, it's also, there's like less heat dissipated around, so there's less collateral damage. So that means less pain, but it's also very effective and targets the tissue and the target that you're targeting, which is the sebaceous gland and the capillaries that we talked about earlier. The other thing that's unique to this technology is that it has a unique collimated beam with the Neo Elite. As you can see here on the left, the collimated beam goes straight down versus the focused, which kind of has a little bit more of a cross hatching here. It's more efficacious that way, has a deeper penetration compared to the focused beam. It's easier to use. You basically can hold anywhere the piece, anywhere from a centimeter to a few centimeters away from the skin, so it doesn't change your efficacy or the jewels. So the safety here, the fluence remains fixed regardless of the handpiece distance, which is important because you're trying to work around the cheekbone and around the mouth and the nose. So it's your hands are actually spared that way. You don't have to try to hold it exactly at a certain location from the skin. So it's a lot more, it's more ergonomically more easier treatment for you and also more comfortable for the patient. And it goes quick. And again, this is kind of going back to those chromophores. So we got the water, which addresses the fine lines and wrinkles, sagging skin tone and texture. So having said that, it is a non-invasive gentle laser. It's not going to be a facelift effect. So please don't promise that to your patients, and I never do. But the texture of the skin will improve over time because it stimulates collagen. The oiliness of the skin will go down, and so that shrinks the pores. There is definitely that effect and the glow to the skin. That's more of on the rejuvenating aspect, but along the acne lines, it definitely helps with that aspect of the texture of the skin. The melanin, as the Nd:YAG targets the melanin as well, it addresses the sun and age spots. And again, I tell my patients, this is not going to be like that aggressive laser that creates scabs and inflammation walking around like you have mosquito bites on your face. This is going to be a gradual improvement of the PIH and the hyperpigmentation in the skin. So you have to sort of set expectations for your patients. If they're going to expect a dramatic improvement of all their brown spots going in, everything else is gone, I mean, that will be not realistic because this is a gentle laser. That's the advantage of it. They can go home right after, go to work right after. There's no scabbing, there's minimal inflammation. So you kind of have to balance the two. And melasma treatments has been undergoing the studies for that. There's promise for that. There's post-inflammatory hyperpigmentation that's improved. And of course, the hair removal. I use it in my patients who have hormonal acne often, and they have both the acne on their jawline and that hormonal hirsutism as well. So that usually the two come together, and that's been huge for my patients who have that hormonal component. And I do add on spironolactone and other topicals to help them along with it. And then you have the hemoglobin target here, the chromophore, which can address the redness with the rosacea, the spider veins, the angiomas, and the acne inflammation as well. And we'll talk more maybe about the settings if some people have questions about how do you specifically address the spider veins. There's different little hand pieces for that. But in general, if you do the general pass with the 6mm spot, it definitely helps with the inflammation, overall calming of the skin on the vascular level after treatments. So going back to this diagram here, this is more of a visual representation where all these chromophores kind of work. Here the pigment, the melanin, and the water work a little bit right here in the epidermis, where you have the skin tone and texture improves, the pigment and melasma, that's epidermal. And as the YAG penetrates a little bit more into the dermis, where it targets the sebaceous unit here, the rosacea vasculature component, starts building collagen, remodeling collagen in this area where the tightening comes from. Hair removal is right at this level, and where inflammation and melasma can also live here. Probably a little more tough to treat. The dermal melasma has always been a tough problem. But again, all this happens almost painlessly. If there is a little bit of hair that you hit or more hairs, that's where it kind of feels more zappy, but it's not as bad as laser hair removals treatments that people have experienced before, because it's a smaller spot size and it effectively goes right to its target without having, with a short pulse duration, without having to dissipate all that heat around it. So in my practice, your laser settings, I kind of live in this kind of range where I use usually 5 to 6, mode 5 to 6 in my skin type 1 through 4. I do use mode 4, sometimes 3 if they tolerate, and it's like their treatment number 10 or something like that. I feel more comfortable. But if you feel like there is a zap, there's a pop, and there's a lot of plume coming off, and there's like, you feel like it's a really strong reaction, you need to tone it down, even though it's like, it's a skin type 5, and you're using mode 4, it doesn't mean that you have to stick with these settings, especially if it's their first couple of treatments. So kind of use your judgment where you are with that. You're supposed to have a comfortable treatment that can sometimes, produce some plume where the laser sucks up, has a little filter that sucks some of that up, but it shouldn't be uncomfortable or very aggressive visually for the patient. Going back to the study, the subjects in the active treatment group had a significant overall improvement, and the sebometer values, the forehead, cheek, and chin, the oiliness of it, overall porphyrin counts were decreased, and the number of inflammatory and non-inflammatory lesions were improved. Whereas the control, the sham treatment group, experienced worsening or no improvement in the inflammatory and non-inflammatory lesions from baseline to the week 12. That was the follow-up visit. So in the investigators, just to give you an idea of how these things were graded, the investigators' local dermal tolerability assessment included dryness, scaliness, erythema, and edema. And the subject's local dermal tolerability included stinging, burning, itching, or tightness or dryness of the skin, and they were allowed to grade that, their experience. So the subjects were all able to tolerate the treatment very well, and I know this from my practice. It's a very nice modality to use on patients because they're not in pain, and both the investigator and subject dermal tolerability were good, and there's no significant adverse events that were reported during the study. So some before and after photographs of the subjects in the control group. Actually, some of them got a little bit worse. So they either didn't improve or got worse. And here you have the sham control where it actually got a little bit worse. I know that there's some people that actually start using AEROLASE and they say, well, the patient's getting a little worse. What am I doing? Am I doing something wrong? Is it the AEROLASE? You have to consider that sometimes patients just get worse, as you can see here. You see, like, the patients can get worse from their hormones, from their whatever they're eating. You can't always control that. You don't know if they're putting shea butter on their face every day, so that's something you have to probe for. The other thing I think is, as you're destroying some of those acne, spots and P. acnes, there could be some inflammation, and potentially that's just my guess, and AEROLASE can comment on that, but basically I think there's going to be some initial inflammation, but I think overall the patients do improve. As you can see in the active treatment group, people do improve in their acne over time. And like with any treatment, medical treatment, your topical treatments, you start them on the retinol. Sometimes there are worsening episodes. So is it the patient getting worse? Is it the irritation? Is it just this purging effect that's happening? We still have to figure that out because every patient's different. But we know for sure in this study that the patients from baseline to the end of the study improved in their acne and inflammatory and non-inflammatory lesions. And you can see this patient improve in some of the pigmentation as well as here, as you can see on the cheek here. And some of this other pigmentation will have to take time to go away. You don't know if patients are picking or not, but this is a great result, and the patient has improved very nicely here. And you can see the inflammatory lesions are down, is around the hair here is actually improved. Maybe some of the oil decrease has contributed to decrease in the acne. And then some of the scarring, if you want to call it scarring or PIH, has definitely improved right here. So in summary, this AEROLASE Neo Elite treatment is well tolerated. It has a very nice safety profile for moderate to severe acne. High patient satisfaction was noted, and there was actually sustained improvement seen within 12 weeks post-final treatment in some of the active treatment groups. So kind of putting it all together. So you've got the patient, it's got the acne, and you've got this treatment along with your medical treatment. You have this tool to try to decrease the side effect profile of some of the things you're doing with the patient, also improve their results. The benefit of, if you want to kind of summarize the benefit of the AEROLASE Neo Elite, is it addresses the causative factors of acne with a single modality. If you were to just use a single modality, if you wanted to, I have a couple of pregnant patients that don't want to do anything. You're only limited to clindamycin and azelaic acid in pregnancy. So, if you have the AEROLASE at your side to help with inflammation during pregnancy, I think it's really important. It can decrease the sebum production, which we know is hormonally driven, decrease inflammation, as well as address the P. acnes bacteria that's known to cause acne inflammation. And then benefit number 2, the Neo Elite Clear is, you can call it analogous to isotretinoin without the side effects and administrative overhead. So I won't go as far as saying that, people who really need isotretinoin can really use this laser and completely won't need Accutane in the future, but it does really decrease your hand holding and administrative costs as if you were to use Accutane. Accutane is very involved, and there's a lot of headache that comes along with it. Monthly blood work, which can cost the patient. They have to be consistent. You worry about liver and triglyceride elevation and other side effects, pregnancy worries, obviously, and then there's a lot of work of your staff. You go into the patient urine test for female patients, and then sometimes some labs that weren't collected. So there's like some things that are really take up a lot of your time and become kind of frustrating. So if you can use a laser to try to, keep a better control on your acne treatment, that would be amazing. So this is definitely your tool to do that. It can be used at any type of severity of acne. So I have some patients that look at this, the nodular cystic acne in the brochure. They say, listen, that's not my acne. I don't think I need this laser. And I say, wait, this can be used for any type of laser or any type of acne. It doesn't have to be this aggressive. So you can start with mild acne, and anywhere between in this range, you definitely can be using AEROLASE to try to decrease any chance of scarring or getting worsening of the acne. As you can see, there's a wide range of skin color patients to the type of acne lesions you see. And it definitely has a place, AEROLASE has a place for treatment of all of these patients in my practice. And over time, as you can see, there's increased patient satisfaction. So if you're just doing a treatment with medical treatment, RX treatment versus the 650 microsecond laser or AEROLASE Neo Elite, is definitely increased patient satisfaction there. And in terms of basically patient revenue with similar, if not less, patient out-of-pocket expenses can be pretty high. So for conventional therapy, patients really still have to spend copay, and they go on their websites and they start ordering all these over-the-counter products. They spend hundreds of dollars there, so they do have spending money to spend on a modality that they will feel like will work for them. So there's a lot of companies out there advertising skincare products that are really well advertised, but the science behind them is not great. So I think the Neo Elite Clear therapy per patient revenue can add to your revenue, but also can help the patients be able to spend their money wisely instead of kind of splurging out on Sephora products here and there, Road and Fields, all this stuff. They end up spending hundreds of dollars where they could have come to your practice, spend it on the treatment with you, and kept the business with you, but also got a better treatment and better results. So in summary, you basically, the physician assessment, right? You have the, what's your plan for using the AEROLASE in your clinic? So you basically will see that you have a dramatically better improvement of the acne after 5 treatments, but also you'll see at least 25% clearance after 2 treatments. So again, this is not clear cut, and some patients will need more treatment, some people will need less, especially if they have mild acne, or patients who have a hormonal component will need a maintenance. So patients ask, they say, how many treatments will I need in total? And I say, well, I can't really tell you that. We'll have to start with this package. I usually offer a package of 5, and we kind of go from there. So patient experience, they do love the decreased inflammation in the skin. There's definitely less redness in the skin, and then the skin is less dry as well. And then less irritated, but they do have a less decreased oil component there. And the treatment time is only 10 to 15 minutes. And during that time, I actually go over their regimen. So as I'm putting on the goggles, I talk about, so what are your, do you need refills for anything? Are you having any dryness with the retin-A that I prescribed? So it's sort of my bonding time, also going over the regimen with the patient. So this is like also increasing compliance. Not only are you increasing compliance by delivering a treatment right there and then, so they can't not get that because you're delivering the treatment, but also you're creating that sort of relationship where the patient feels accountable for the products they're using. And if they're coming back to see you for this treatment and they need like a little injection in the pimple, you're injecting that day along with the treatment, and you're doing a chemical peel potentially that day, that really kind of brings in more revenue into your clinic, whether it's medical treatment as an office visit. If they do it monthly, they get an office visit, and I make a little extra time for treatment if they want. So it basically can be combined with your medical practice for sure. And number of treatments, I think a good range is between 3 to 6. I offer my patients about 5 sessions, and I tell them kind of see where they go from there. And you could do it every 2 or 4 weeks, or more spaced out for maintenance. And this patient, for example, even after first treatment, this is not always obviously the case, but you could see how their oiliness is down, even their inflammatory lesions are decreased, and some of the pH is decreased a little bit as well. And in this patient, as you can see, you can actually combine your AEROLASE NEO Elite treatment with other modalities. In this patient, it was combined with a microneedling. I often combine AEROLASE with other treatments like chemical peels and RF microneedling because it addresses the redness and an inflammatory component. I do that first, and then I combine it with the other modality, like a chemical peel, which requires a lot less time for me. And you can see the patient had a really nice result. Obviously, this is a combination treatment, but I think AEROLASE definitely has a role in your combination treatments in your practice. This is one of my patients that I was struggling with for several weeks. She's had acne for a while, but then she's kind of flared for some reason. I don't know what it was. She gets facials all the time, so I don't know if there was some kind of infectious component, there was a hormonal component there. And then she was taking Doxy, which was giving her some issues. Spironolactone wasn't working within several weeks. I was sort of getting worried about scarring in her face, and it was kind of going down her jawline where there's a lot of movement there, and I was hoping it wasn't going to cause permanent sort of these very tight scars there. So, and she did not want to do Accutane. So we started the AEROLASE and also did some chemical peels. I did some injections. She kind of continued on and off on the Doxy and the spironolactone because she did not like taking medications. And so within 4 treatments, this is 4 treatments, but in the beginning, I think we did like 2 in a row, which was like 2 weeks apart. And then she started clearing beautifully, and she still comes in for maintenance. We ended up doing a radiofrequency microneedling for her afterwards, but she's a very conservative patient, and she doesn't even like to take her spironolactone. She like takes it on and off. But she comes in for AEROLASE regularly, and we do some injections here and there. So it's definitely a nice treatment option for every acne patient and beyond. Especially your acne patients will always ask about acne scarring, and they will also ask about rejuvenation as well. So it's basically a tool that you have in your office that you can add on to the treatment modalities you currently use for your acne and acne scarring, and also differentiates you and helps you stay profitable. So a lot of times you can't make every patient happy, but a lot of times, patients are dissatisfied with something. So I think this will improve patient satisfaction, because everybody loves this quote unquote laser technology nowadays. It definitely will improve patient experience and satisfaction because your patients will see results as well. It leads to your office profits, so increased profits in your office. If patients would rather, spend $200 to $300 per laser treatment in your office, depending what your prices are, it could be anywhere from $300 to $750 per session, depending on the provider and the patient in the office. I would rather them take that money instead of spending it on some cream, some Goop, or some other advertisement on Sephora or elsewhere, where it has only clogged their pores and they're back to you, with a breakout. So there's a way to educate your patients about skincare, but at the same time, you want them to be using a laser technology that can help them along with their treatments. Your reputation definitely will be improved if your patients feel like you're on the cutting edge of, acne treatments, and this is a very easy laser to start using and learn, and the learning curve is actually pretty easy, so it's not intimidating, and patients attraction to to an office that has these technologies is definitely valuable. And there's an ability to address other conditions there too. I started using it in nail fungus along with topical antifungals, and starting to do it in my melasma patients very gently because they all are very sensitive to heat. But there are studies out there with AEROLASE that have shown that it helps with melasma. So I find that it's just been amazing in my practice, where it doesn't hurt. When you first introduce a laser technology to a patient, you say, this is going to be a laser. They say, is it going to hurt? Is it going to leave me with a scab? Is it dangerous? Is there a scarring? So I think you basically can be pretty safe with the 1064 if you're using it appropriately. So I think that if you incorporate it into your practice, it can only do your practice good, and increase your profits. Your patients will be happier, you'll be happier, and all across the board, it'll be a better practice for acne and rejuvenation in general. Thanks, guys.
Thank you so much, Dr. Kobets. And we do have some questions coming in. And I just wanted to let people know, if for any reason we aren't able to get to your question, we will follow up with you to make sure we get you an answer. But one attendee is asking, do patients need to stop their prescription topicals or their orals before you do the laser treatment?
Absolutely not. It's actually perfect. This technology is perfect to be used together with the medical treatments, with any prescription or over-the-counter treatments, because it works synergistically with it. It can only help those treatments work better. So if somebody's using a topical treatment, I think AEROLASE will help the penetration of the retinols or anything else, a lightening cream, as it kind of heals the skin and remodels it. So absolutely not. You don't have to stop your treatments, because sometimes people think they have to stop the retinols before they do like an aggressive laser or a chemical peel. This is not the case here. It's safe to continue all your treatment or all your topicals and prescription medications before and after the laser, the AEROLASE Neo Elite treatment, and you can go straight back to work, put your makeup back on, and you're good to go.
And do you use any topical anesthetic for the treatment?
I rarely use it, only if I'm going to do like a radiofrequency microneedling afterwards. I never have to use topical treatment for the AEROLASE Neo Elite because it is virtually painless. There is some heat, and sometimes there are active cystic lesions that are just painful on their own. So when I go over a few times over that, I just warn the patients, you're going to feel a little bit more extra here in this area, but it's good because I'm heating up the area, targeting that specific area. And when there's hair on the face, there's a little bit of zapping, but that does not require topical anesthetic at all. So I never use it specifically for AEROLASE, and that's the the beautiful thing about it. You don't have to have the patient wait there, putting on that greasy topical numbing, and then you have to wipe it off. So there's definitely not a need for that. It's a very comfortable laser, and people actually enjoy the warmth of laser during the winter months, especially. They come in, and once they're like over that, like that kind of, they're afraid of lasers, quote unquote, once they've had a few sessions, they just kind of sit there and they relax, and some of them just like feel like it's like a spa treatment for them because they feel very, very comfortable, and it feels good for them.
And do you treat the entire face, or can you spot treat problem areas? And is there a risk of creating lines of demarcation?
Definitely, you will not create lines of demarcation. AEROLASE, the 1064 wavelength and the short pulse width duration is not an ablative laser. It's a non-invasive, not ablative, and also does not create any scabbing afterwards. It calms the skin, it decreases inflammation, and so there should not be any lines of demarcation. You can treat like cheeks if somebody has specific problems or a breakout, but I figure if you're going to turn on the laser and have a treatment for one pimple, you can do that. But I think you should kind of encourage a patient to try to do at least like a T-zone or a portion of the face, because they're just they're there. They might as well get the glow and the improvement in their texture since they're already there and they got the goggles on. So I think it just makes sense to just kind of do a bigger portion than just one specific pimple, but you can do portions of the face and there's going to be no lines of demarcation at all.
And how long do the results typically last after you do the first series of sessions?
I would say if you were to do just one session, you'll definitely see a little bit of that glow, a little bit decreased oil production, but I think it'll probably last a few days. But if you're consistent and you're coming in, every 2 to 4 weeks or every month, I think the results last for a week or so or longer. When you say like lasting results, there is the apparent glow or that feeling that the skin has calmed down. But also, like, if you're compounding those treatments over time, you're basically building that collagen over time, which is yours to keep, unless, we all age, we're all exposed to the sun. But if you continue to have this non-invasive treatment over time, you're just building that, you're stimulating that collagen over time and helping with those superficial scars and inflammation. So the lasting effects of that, I think are definitely longer than weeks to months if you're maintaining your skin over years.
And what treatments do you typically prescribe to your acne patients who are getting laser treatments, like home? Do they still do prescription home care?
Absolutely, it depends on the patient, but I still prescribe the whatever is appropriate for that type of acne. So I prefer to have a patient on a retinol of some sort, whether it's over the counter if they have something that they use already that they don't want to feel irritated, to all the way to prescription tretinoin. I definitely use antibiotics, and I definitely use the androgenetic blocking agents like spironolactone, aldactone, because if they have a hormonal component, I don't think it's fair not to offer those options to them, just because it'll, from the inside, help them treat that part of the acne, but could be safely combined with the AEROLASE that helps from the outside. So it's a synergistic effect, and I think it just helps your medical treatments work better, honestly.
Great. And we have time for one more question. And there was a question about the risk of PIH in darker skin types. Is this a concern, and do you do any kind of pre-treatment to reduce the risk?
As with any treatment in any skin type, with any laser treatment, you always want to be conservative the first time you do something with a patient. So for skin of color patients, there's a higher risk of having an inflammatory response from the heat. I mean, it's still a laser, there's still heat, even though it's more controlled compared to other laser modalities. So if you are too aggressive in the beginning, as with any laser technology, you can still cause heat, to bulk heating and inflammation in the PIH. But it's supposed to, if you do it appropriately, it's supposed to lift that pigment from the dermal and epidermal component, and over time helps the remodeling of the skin to lift that post-inflammatory pigmentation from acne and prior inflammation. So if you are going to treat the hair on the jawline, you have to be careful with the bulk heating there, because there's going to be more heat accumulated there. So there you have to be careful with overdoing passes. But in terms of post-inflammatory pigmentation from the AEROLASE is it's not something I worry about. I just make sure I use my laser appropriately for the pigmentation when the patient comes in for that problem from their acne or prior inflammation or melasma.
Wonderful. And I wanted to let people know that if there are any sections of the presentation they want to go back and review, if they wanted to share that with any of their colleagues, this will be on our website later today, metaestheticsmag.com/webinar. And again, if we did not get to your question, we will follow up with you and get you an answer. But thank you all so much for joining us. And thank you, Dr. Kobets, for joining us as well.
Thank you for having me.